Welcome. My name is Julie Fresto, and we are here today with Linda Samuel. And Linda is going to be talking about occupational therapy and being a therapist. So here she has a great presentation. I'm just going to turn it over to her, but just a few reminders. Please enter your questions into the chat box. I will be monitoring the chat box. So when questions come in, I will find a way to sneak them into you, Linda. And students, we're here for you to get your questions answered. So please do that.
Sure, Julie, and shout out if I need to stop or something, because I won't monitor the chat once my PowerPoint's up, okay?
Sure.
I don't mind being, okay. Well, hello, everybody. I'm glad you're here. As Julie said, I'm Linda Samuel. I'm currently the Dean at Concordia University, but I am an occupational therapist. So I started as OT faculty, and then I was the OT director for 10 years. And then now I've been the Dean of the health professions. So at Concordia, we have, you name it, we have it: OT, PT, speech, PA, rad tech, sonography. That's all within under my umbrella, in addition to social work. And then we have, of course, pharmacy and nursing. I'm going to do the PowerPoint and share my screen. But again, please feel, shout something out. If you want to put it in the chat, you can do that too, and Julie will show me. I do have a video, so I want to make sure that we get rolling on this. So again, I'm from Concordia, and we're talking about occupational therapy, which is a great career. It's been very good to me. My son is an OT, and actually two of my daughter-in-laws are OTs. So I have lots of OTs in my family. And so when you wonder what is occupational therapy, oftentimes we don't know what it is. It's hard to say. It helps people do anything they need or want to do. So we work with any age group, and we work with any person, no matter what is wrong with them. I worked with young adults who primarily had psychiatric illnesses, and I helped them engage in their occupations of life: dating, going back to school, living on their own. And so occupation is really what matters to you. What do you want to do? What do you need to do? And then an OT will work with you to figure out a way to do it. So you might be a small child who needs your milk opened, and you can't because you don't have enough strength. We'll figure a way to help you get that strength, or an alternate way to open that milk, or a different type of milk container. You could be 80 years old and you want to play bingo, and you want to be able to use that dauber, but you have difficulty with it. You can't raise your arm. We'll help you with that. Putting on coats, driving a car, you name it. Occupation is anything you need or want to do. The OT is there for you. And so we don't care about what's the matter with you, really. It's more, what do you want to do? We're there to facilitate it. And so as this says, we help all age groups, all people, all types, in a number of different situations. I'm going to show you a video, and it's from the American Occupational Therapy Association. It's a quick, I think it's 12 minutes, and it really does a nice job going over it. I have a number of other slides that I can talk to you about, but this is a nice overview, because we as OTs are not good at educating people on what OT does. Usually if people want to be an OT, it's because they've worked with an OT.
My goal for you is to be as functionally independent as possible with what you love to do in life. How about all of art? It starts with empathy. You have to, at least for a moment, just be able to understand what they're going through.
I am a passionate tennis player. I was playing in a social, and as I served the ball, I ended up with a tingling sensation on my index finger. So I had the MRI done, and it was determined I had a ganglion cyst that required removal by surgery. And he said, there is a possibility that you may not have use of your hand to play tennis again. But I said, oh no, I'm determined. I'll do whatever I have to do to get the feeling back in my hand so I can brush my teeth, comb my hair, wash my hair, to get myself back on the tennis court.
Occupational therapists in general are essentially creative problem solvers. It's helping somebody not only return to something they love, but be able to do that themselves. I don't just care about your range of motion today, your strength. I care about how you're going to use your hand for the rest of your life.
We look at the whole person. We look at the physical, we look at the emotional, we look at the environmental. We have to really take in everything about that person and what's important to them, and then problem solve, how are we going to take care of that issue? It can start in the neonatal intensive care unit and go all the way up through the entire lifespan. Occupational therapists are especially trained to solve problems to help people's lives be better. We have a stronger skill set in that than any other profession.
I'd like to go back to doing my photography. I need to be able to lift the camera to my eyes. So that's what I'm working on. It's very important for me to be independent, and I think the occupational therapy has made a great, great difference.
My daughter is profoundly deaf, so she has cochlear implants, which help with the hearing, and she also has an autism diagnosis, so she has multiple sensory issues.
For a child, any child, one of their occupations is play. That's just naturally what they do. Good. Ori. Play is something that you can't always teach, so we incorporated play into function. I like how you're drinking your juice, Julie. Taking turns, which is a huge play skill in peer interaction. Figuring out how both sides of my body work together and how that is all integrated into our brain neurologically.
The sensory integration is just what my daughter needs to facilitate all her motor skills, her balance, her vestibular system, and it just made a dramatic difference.
The results are a child finding themselves, not catering to what is inhibiting them, but to what is strengthening them.
You ready? 1, 2, pull up. I see Scott engaged more. I see him lift his head up. I see him attend to things. Give me one more hit with the soccer ball. Thank you. That's awesome. All right, let's try something else. Do you remember that? For me, OT is the ultimate problem-solving profession because every day I have a chance to engage with somebody like Scott, and I'm going to figure out how to break through. I can use things that are really familiar to him. He's a race car driver, so I can use his steering wheel. If it's something that he knows about, he's going to be like, oh yeah, that's mine. I know what that is.
Every idea that she's had, I've never even thought of.
Just like we were practicing over on the mat, we were practicing on keeping your head up. We were practicing on sitting up on your own. You got it? Nice.
He didn't move, he wouldn't do anything, and we've only been here 3 weeks, and I would have never thought we would have made it this far. His going rate, he's doing good.
You got it.
COPD, the major symptom besides not being able to breathe is fatigue. Every step you take, your lungs are working harder. So I knew that it was just a very short matter of time that I'd be in an assisted living facility. And I couldn't bear that. I have a cozy little apartment. I've made it a home, and I want to stay here.
In order to, maintain her independence and be able to live where she wants to live, we spent a lot of time talking about what do you value and how do you see your life changing.
Oh, this looks so comfortable.
We can adjust the height.
Okay.
And I did put some non-slip rubber grips on the bottom. As an occupational therapist doing home modifications in the community, I feel it's very important to develop that rapport with people and develop that trust so that together we can come up with those solutions and make a difference.
What Carly has done, using the tools of occupational therapy to ensure that I don't get exhausted, has improved my quality of life. And when that happens, you're a happier person.
Dennis was getting ready to move out of a nursing home and was bored in his room, and he would color lots of pages in his coloring books and just wanted to be able to go out and do things on his own. So we worked a lot on social skills in a natural setting, ordering what he wants, managing the money,
$4.
and not having people do so much for him.
I'm learning about money a little bit, how to count the money and everything.
it's really great seeing them interact with people in the community and not focusing on mental illness, but focusing on enjoying myself around other people that are doing something similar to me. And it feels really good that OT has that ability to help people really realize that potential for themselves.
My future, maybe living a long life if I could, and down the line, maybe getting the community and paying bills and getting my apartment and setting goals and stuff like that. Everybody's doing wash today.
I was in Atlanta and I had got drunk and I was laying on the sidewalk and somebody took a picture of me. And that was the first time I really looked at myself and said I needed help. Because when I looked at the picture, I could take me out the picture and see the chalk line. I came in and gave me a chance to get myself together, have a foundation and a program that I never tried before in my life. Re-educating me and helping me learn to function was the best thing about OT for me. When I get to put a room together knowing that a new resident coming in, I know I'm getting them the same opportunity was given to me when I came here. My hopes and dreams is to be happy, that I'm part of society, that I'm contributing.
I have chronic illness, put me in a deep depression. So that brought me to a whole new understanding of life.
You ever make cookies before, or you started doing it when you came here?
I started making them when I came here.
Yeah.
What makes OT a little bit different? What's something that you like?
Give us the opportunity to say how we feel, what we feel, to go out, go to meetings, you know, cook in the kitchen. I love saying that, cook in the kitchen.
What's always been the most important is seeing them progress and know the things that we've done here are helping them get their lives back.
I'm proud that I could say this is home.
The evidence is really strong now from the scientists in neuroplasticity that using real-life situations will give better changes on a neurological level. You'll see more improvement when we use occupation in our treatment.
With different therapy, it's helping retrain my brain to send the correct signals. If I do it enough, my brain should kick in and I should be able to do it on my own.
Lisa's arm is supported in a mobile arm support. We have some functional electrical stimulation, and then I'm triggering the stim, so it triggers when she grasps, and then as soon as she makes her way across her body and over here into the bag, I let go of the trigger, and Lisa focuses on opening and extending her fingers. Nice. There, very good. Next one. Trying to tap into everything Lisa enjoys doing. This is something that's important to Lisa. She enjoys makeup.
I came here to get more intense therapy. And using my hand, I know it's not going to be perfect, but little by little.
I joined the Marine Corps with the MOS of infantry. Actually on the front lines, doing patrols, doing that. That's what I did. We were on our last patrol in Afghanistan, and day one of that patrol is when I stepped on the ID. It blew up. The charge was right underneath my left and right leg, how they were spread open, so it split me in half. And it was 28 minutes from blast to me getting put on the medevac and put into a medical coma, which is really quick considering how far out we were from the medevac site. So when I got to Walter Reed for a week or two or more, I was doing 3 surgeries a week. And the OTs would come into my room and we'd do ADLs, stuff that I was gonna use all the time. So I was very eager to learn it. OT got me to the point where I could be independent, drive myself, be in my own wheelchair, get up and down hills and use prosthetic legs. It was full speed ahead. The quicker you could start getting all this stuff and you become more independent, you just feel like yourself again.
not only was the OT helping him regaining his independence, that also helps me find my balance of being a wife and a mom. So as they're helping him, it's also helping our entire family.
Pretty amazing stuff that the OTs can do.
Patrick and I went for a walk on a beautiful spring day.
Had very little to worry about, and we had our whole life in front of us.
And now we are both lying in ICU beds. And could it be true that we're both amputees? To our occupational therapist, you walked in our room and gave us our first shower after 5 weeks of bed baths. You instantly made us fall in love with you and your profession. Over the course of these last 3 years, you have equipped us with a myriad of skills and tools that help us reclaim our lives. Thank you for dedicating much of your lives to this unique profession of occupational therapy, where science, creativity, and compassion collide.
Okay, so I think that video really gives you a nice overview of the breadth of what occupational therapists can do. And so where do they work? We can work almost anywhere. A big chunk of us work in hospitals. We can work in ICUs. We can work in neonatals. We can work in rehab right on the hospitals. We can work in outpatient clinics where people live at home and they come to the clinic. It can be a hand clinic because we can be hand therapists, neuro, which is the brain and the spinal cord, orthopedic with his muscles or bones. Skilled nursing facilities is what we sometimes call nursing homes. Subacute units on a skilled nursing facility. That's where a part of the nursing home is for people who need some rehab. They don't need to go into a hospital, which is more expensive, but they can come to the nursing home, get rehab, but they go back home. The goal is not for them to stay there. In every public school in the United States by law, you need to have an occupational, physical, and speech language pathologist available for the students who need our skills. Behavioral health is a combination of psychiatric and addiction is where OTs can work. And that was my background. And then home health. We can go into the home for people who are not able to get out to the outpatient center. So we can work in many different places because we work with any age and any type of person who want to do something, but they're not able to do it. And it could be because of thinking or cognitive. It could be visual, it could be hearing, it could be walking and talking, it could be any part of the body can be affected. So how are we different than physical therapy? Everybody knows what a PT is, but no one seems to know what an OT is. PT and OT are sometimes we overlap. We would say that we're really focused on those occupations. We use occupations to help people get better. PTs are experts in understanding the bones, the muscles, the movement of the human body. They tend to use more exercises, do a lot of gait training, which is walking. We're OT, if we need you to walk, we certainly work with the physical therapy, but we'll have you walk into the kitchen and reach for something. We'll have you walk and get something out of your closet. And so OTs and PTs work well together. We complement each other. We are different professions, but not one profession can do it all. We need a team to help all of our patients. If you think of, well, what are you good at? PTs have need more knowledge in physics, chemistry, biology. And so some of those, what we call hard sciences. If you're not good at those or you don't like those kind of classes, but you're really good at anatomy, you love problem solving, you love understanding the psychology, the brain, the thinking, OT would be a better fit for you. Educational requirements, if you want to be an OT, right now you can get a master's degree. Sometimes it's called an MS, sometimes it's called MSOT, or you can now get a clinical doctorate. A clinical doctorate is not a PhD, but there are some programs where you can get a clinical doctorate. So you have a little bit more research, a little bit more time, you do more field work, and you become a doctor of occupational therapy. At Concordia University, we have the option for you to do either one. We have a master's program and we have a clinical doctorate program. So you can move through the education and then at one point say, okay, now I want to go on to the OTD or I'm going to do the MS. You have that option. Any new program can only start OTD. But right now with a master's degree, you can become an occupational therapist. We have a number of schools in Wisconsin that have occupational therapy. Of course, my favorite is Concordia University, Wisconsin, but there are a whole group of schools that have OT programs. We've had our program at Concordia since 1994. I arrived in 1995. I went to the University of Wisconsin-Milwaukee to become an occupational therapist. Concordia was not present at that time. So what's the salary? This I got from the Bureau of Labor Statistics. So this is kind of a national median. Median is $86,000 a year. Median means if you put everybody's salary on a roll, it looks at what's in the middle. That's a better indicator than just averaging, because you might have some people with really low salaries or some with really high salaries that adjust the mean. So this median is about 86. It depends on where you live. Different states pay higher because they have a different cost of living. And when you look for the future, are there going to be a need for OTs in the future? The Bureau of Labor Statistics states that it's about 70%. It means it's much faster than average. They'll need more OTs in the future. So being able to graduate and get a job is very likely. So at this point, I guess if there are any questions, I'm going to stop sharing. And so I can see Julie, and you can shout out questions, or Julie's going to ask me if there's any, or let me know if there's anything in the chat.
Great. Thank you. Okay, we are getting some questions and wonderful. Camille would like to know, what advice would you have for someone wanting to go into this field?
First, I would spend some time with an OT. I know that's hard now with the pandemic. Most schools used to require you to spend about 40, maybe 40 hours or so shadowing, and shadow all different types of OTs. But maybe you shadow an OT who's with kids and you don't like it, but you might like the elderly. So if you're not able to shadow, certainly if you can volunteer somewhere, or if you can work in an area where there is OTs and others, you need to really find what's the best fit for you, because you have the potential of doing this job for 40 years. So you want to get in the right profession where you can help people. I, of course, love OTs, but other people, other professions are also good.
That's a great question. And I was just in a meeting this morning with a bunch of healthcare system people. And yes, because of the pandemic, we're still kind of having issues getting out and doing job shadows. However, what they suggested is that students start volunteering, and volunteering is always needed in facilities. And you can often see not only OTs, but you can see many different types of healthcare professions. So I would highly encourage you to look at volunteering as a first step.
Yep, I agree.
Sydney would like to know, can you elaborate on the psychiatric side of OT?
Sure. Psychiatric is for people who can't do their occupations of life. They don't want to go out in the public. They have difficulty because of their thinking or their hallucinations. They can't take care of themselves. And what an OT does is work on those skills with them. If they're very low level, when we started out in psychiatric, we would give them tasks to kind of keep them social and do things. So sometimes it's crafts so they can get used to being around people. And as their medication kicks in, then we can let the doctors know, and then we can help them advance. For my higher level patients, I would teach them communication skills, assertiveness training. How do you let somebody know that you want to return something, or there's a problem with your meal? How do you interact in relationships? How do you date? How do you deal with things? So it's a wide range. It's anything your patient needs to do. You have to figure out a way so that they can do it. So there you have to be really creative. And then you have that stigma of the mental illness behind it.
Yeah, great question. A lot of good ones coming in. Next question. How many patients would you see on an average day?
When I worked in psych, I did groups. So I probably had 6 groups a day. When you work in an outpatient clinic or a hospital, they do look at productivity. And so they want to see, so example, if the productivity rate is 80%, 80% of your day, you must be with patients, working with them and charging for them. And so I just saw someone said, what's the hardest part of the job? I think it's that. You want to spend time with them. You want to do everything for them, but we are oftentimes limited by what insurance will allow us to do and what we'll get paid for. And so most places we have to be pretty productive. That's the same thing with PTs and speech and PAs. You have to move a little quicker than you used to because of reimbursement. So that's probably the downside of it.
Yeah, great question. And that kind of goes along with Josephine wants to know, what is your favorite thing about being an OT?
Oh my gosh, I love helping people. I mean, you think, because all of you think, being an OT, brushing teeth. Wouldn't you want to brush your own teeth, be able to go to the bathroom by yourself, take your own shower, drive yourself? Think of all the things you need or want to do. And that's what OTs do. We help people do things that they want to do. And so sometimes it's not the most glamorous job, but when a person can do it without help, it means so much to them.
Yeah, that's great. We worked with an OT when my son broke his thumb, had it shattered in an accident, and he was 2. It was so fun
Okay.
to watch her do certain things like in your video to get a 2-year-old to learn how to do things again.
Right, right.
Just wants to know how many years of school is a clinical doctoral degree?
Clinical doctorate, generally it's 4 undergrad, 4 years for undergrad, and then 3 for the doctorate. In Concordia, we have an accelerated program where we can take a year off. So you can do your undergrad in 3 years and start the graduate program. And so you're done a year earlier. And you can also use some financial aid for the first year of a graduate program. You can't get financial aid in a graduate program. You usually only can get loans. So this allows you to use financial aid a little bit longer. So for us, it's about 6 years.
Oh, that's tremendous. Lucy would like to know, how does technology help you be an OT?
Oh, a lot. We can do telemedicine. During the pandemic, our students were doing telemedicine. So they were doing occupational therapy via the web using the Zoom. The technology, there's lots of new equipment, new things that we can use because the technology is always changing. The different diagnostic tests that can be done, we get a better idea of what's going on. So it's really kind of helped us. Now, of course, when you do home health, you have a phone right there. You can communicate with people. And then that's a big part of our job is teaching people how to use the technology that they're not used to.
Great. Nora would like to know, do you still have a good balance between work and your family?
You do, because we do not work 3 shifts. We usually work first shift, but we do work weekends. So the good side of that is when I worked in psych Monday through Friday, I would work at a different place in brain injury on the weekends. We call that PRN, which is as needed, or sometimes we call it pool. Pool doesn't mean you're swimming. It means you're a group of OTs that will come in on the weekend and work. And so we do have to do some weekends and we do have to do holidays. But again, it's generally not second and third shift.
Okay. And how many house calls do you do?
If you're home health, I think that depends. Now, my daughter-in-law is a home health pediatric OT, and she has the opportunity to pick how many cases she takes and where she goes. So she schedules her time. So she has a little bit more flexibility. So there are pros and cons with that. But if she could be really busy if she wanted and go all day long, every day, she would just need to be really good at scheduling that they're like in the same part of the city. But she's doing it because she was kind of tired of working every single day. This gives her a little bit more flexibility.
Love that. Liv would like to know, what is the best way to get into shadowing?
Shadowing is hard. And again, with the pandemic, I think you're going to struggle. I think volunteering, and usually for volunteer work, there's paperwork you have to fill out. You often have to watch videos. There's confidentiality paperwork. There's background checks. And then you usually have to stay for a period of time. But they are looking for volunteers. So probably volunteering, as Julie said, is probably an easier route than just shadowing because of confidentiality, but also now with the pandemic, they can't risk you getting sick or the patients there getting sick. So they're really limiting that.
Yeah. A couple more questions have come in, and then students, we're going to have to cut it off. But Josephine would like to know, is your job ever stressful and why?
Sure. It's stressful because, again, the productivity, you have to keep like working and documenting. The fun part is being with this patients, but documenting you have to do. And sometimes people are in pain and you're asking them to do things they don't want to do. So that can be difficult. That can be kind of stressful, but it's more just trying to get your work done in an efficient manner when you really would like to spend more time with the patients.
Yeah. Lucy would like to know, what do you have to be careful of when treating a patient?
Lots of stuff. Well, confidentiality for sure. You can't talk about anybody outside. Sometimes you have to be careful when you're transferring or moving them. Of course, you don't drop them. Sometimes when you're moving them, if they have real brittle bones, you don't break them. So you have to know what you're doing and know when you need help and when you're not sure what to do. But it depends on the patient. But you have to treat that patient with respect and you have to make sure they're safe. You don't want to put them in an unsafe circumstance or anything that's unethical.
We have two last questions. If you had to change careers, what would you do? Great question.
Oh, I don't know. I'm not sure what I would do. I was in track to be a pre-med and OT, and I decided I didn't want to go to school forever. So I did OT. Well, now I've gone to school for 12 years because I went back, got my master's in school psychology, and then I got my doctorate. So I don't know what I would do. I think maybe a physician would be interesting or something neuro, maybe a neuropsychologist, but OT I loved. OT has been very good to me. So I'm not sure.
All right, last question. Camille, how did COVID affect OT?
Well, we of course had to gown up. So we had to wear goggles and masks, and we still had to see our patients. We had to, some places they were getting tested for COVID every day you walked in, every day you went out. You had to go to work. So there was always that scare of, oh my gosh, I'm working with people with COVID. But we go into this because we want to serve other people and help other people. So we have to put what's best for our patients. And so if we couldn't see them, then that's when we would do telehealth, but we had to go to work.
Yeah, super. All right. Well, everyone, we are at our time already. Linda, this was fabulous. If they wanted to learn more about your program at Concordia, could they get in touch with you, or is there somebody else that they should get in touch with?
You can send it to me or send me in, and then I'll forward it to Carrie's email. She's got a hyphenated name, so it's a little bit hard to figure out, but yeah, just send it to me and I can give it to the head of the OT program, Dr. Carrie Shield. Anything about Concordia, anything you need, let me know.
Wonderful. Well, students, again, thank you for joining us today. Thank you for your great questions. And Linda, thank you so much for your time.
Thanks, Julie. Thanks, everybody. Good luck to you.
Bye.